There is a consensus that the health status of the tribal population is very poor. It is even worse among the particularly vulnerable tribal groups, the PVTGs. Parivaar's experience of working in the remote and poor tribal villages in Madhya Pradesh has highlighted the dismal conditions of people suffering from various diseases or disabilities. Due to poverty and lack of access to good hospitals and doctors, they suffer from sickness without getting the desired treatment. Unfortunately, adequate attention has not been given to the issue of tribal health, and this situation needs to be tackled on a war footing.
We identified this need during the COVID period when we had, for a very short duration, we had started this general medicines and health checkup programs, because as you know, during COVID, this medical care just came up as a very big issue. But we identified that even during normal times in all these places, people cannot get access to a basic, decent medical consultation.
The team of a mobile health clinic is well organized and compact. It consists of a doctor hired for this purpose. He is aided by an assistant. Each doctor visits 3 to 4 villages in a day. Free medicines are supplied for ailments such as cough, cold, fever, vomiting, diarrhea, etc. This team examines 100 to 150 patients in a day.
Not just basic care, even there are many cases where we, through these mobile clinics, it was identified that these cases were very severe, such as cancer or even other major illnesses. So we did not just stop at the level of mobile clinic. We got these patients, many of these patients we are getting them treated at big hospitals such as AIIMS Delhi or even other such hospitals in Indore, Nagpur, AIIMS Jaipur, and all these places. So we try to take care of the person, of the community in all these areas of our operation till the time they need it, and whatever they need in a particular service that we are providing.
Both the legs of Vijay got gangrene. He tried the local herbal treatment and visited hospitals, but there was no use. Disappointed, he gave up everything. His movements stopped. Somehow he came in contact with a Parivaar volunteer who made the mobile health clinic treatment available. Then the mobile clinic referred him to the Delhi AIIMS hospital. The gangrene problem grew and the possibility of amputation of the legs was pointed out. But timely and proper treatment in AIIMS prevented the amputation of the legs, and now he is in walking and working condition. Even now the Parivaar team takes him to Delhi for follow-up. Parivaar volunteers are always ready to render service according to the needs of the patient. Often, due to neglect and ignorance of the disease, people take recourse to superstitious practices. Such people may never have heard of something called mental stress. For them, their illness or comprehension and its causes are often beyond their imagination.
डीजो बाज रहा और खूब नाच रही थी, नु गिर पारी, हमने सोची मेरी लड़की कैसे पड़ गई मेरे के नीचे.
Manisha's daughter was dancing to loud music. Suddenly she fell down and became unconscious. On becoming conscious, she was not able to understand anything. Her behavior was strange. For example, throwing utensils, running away, unaware of the condition of her clothes. In brief, she behaved like a mad person. As for treatment, local superstitious practices like cock and billy goat were sacrificed, with no positive results. Her unnatural movements kept increasing. Manisha's brother-in-law sought the help of a Parivaar Sevavrati. He took her to a mobile clinic, which referred this case to Gwalior, which is 200 kilometers away. A Parivaar ambulance took the patient along with 4 of her family members to Gwalior. Manisha returned from Gwalior with the impression that the doctor is like a god, as her daughter is cured and is now living happily with them, performing all household activities. She has to be taken to Gwalior occasionally. There, right from checkup to treatment, all expenses were borne by Parivaar and cooperation in all respects was extended.
अब सब काम भी नहीं करवाए हमारा तो।
For the Parivaar Mobile Clinic, the service of humanity is of paramount importance, and they go out of the way to ensure that all the visitors who come for a checkup and treatment are taken care of, irrespective of how far the medical facilities are located.
सफेद पुतली पड़ी थी बच्ची की।
Ramraj's son Yuvraj developed a white pupil in his eye. Later on, it turned red and bulged out from the eye. Ramraj took him to the Savai Madhopur hospital, which referred him to Jaipur. But then, because of lack of money, they came back home. Incidentally, there was an eye camp held by Parivaar in Karahal. Here, the doctors diagnosed the condition as eye cancer and referred it to Kota, 181 kilometers away. The boy was taken to Kota in a Parivaar vehicle. There, the doctor advised them to take the patient to Jaipur, 260 kilometers away. After seeing the criticality, the Jaipur hospital doctors referred him to AIIMS Delhi, which was 267 kilometers away. He was admitted to AIIMS Delhi. They stayed there for 18 days. Over this period, 11 chemotherapy sessions were completed. Even now, a Parivaar Sevavrati takes him in their vehicle to the hospital twice a month. All arrangements are made and he is taken care of by Parivaar. Now the child is quite okay and Ramraj is happy too.
शुरुआत में जब हमारी गाड़ी आती तो लोग भाग जाते थे।
In the beginning, when the vehicle used to go to provide the services, people used to run away. Often, people had to be dragged to the mobile clinic. Today, after a year, the situation has changed. As soon as the car reaches the village for the camp, people start coming on their own. A positive atmosphere has been created. The concept of health education has reached the people. Villagers went to big hospitals and realized the importance of the doctor. Due to ignorance, the villagers would often be prescribed wrong medicines, including steroids. Now, however, they have been saved from the effects of steroids. This change has come through the mobile clinics.
ये परिवर्तन मोबाइल क्लिनिक के थ्रू आए।
There is a perceptible awareness and acceptance among the local people. Earlier, a wrong attitude toward illness prevailed. Now, they are adopting the treatment prescribed by the mobile clinics instead of going for superstitious and wrong treatments. Parivaar is running 15 mobile clinics across the tribal areas of 9 districts. All these are very remote and very poor areas. And Parivaar has got more than 7 lakh cases treated, and the organization has distributed free medicines to these many people in the last 22 months. The selfless and dedicated service of the Parivaar Mobile Health Clinics is serving lakhs of extremely poor tribal people living in remote areas. The mobile clinic has made the dream of a doctor on wheels become a reality, benefiting lakhs of tribals in the far-flung corners of India.